Imagine two brilliant minds, identical in every way, destined for greatness in the most demanding of professions. They shared a bond so deep, so consuming, that it would ultimately lead them down a terrifying path into shared delusion and self-destruction. This is the chilling true story of Cyril and Stewart Marcus, twin gynecologists whose lives descended into a spiral of madness, revealing the fragility of the human mind and the devastating consequences of unchecked obsession. Welcome to the dark chapters. The Promising Brothers. Cyril and Stewart Marcus were born into a world of promise and privilege on February 28, 1930, in a well-to-do neighborhood of the Bronx, New York. From the earliest days of their lives, their bond as identical twins was extraordinary, marked by an almost uncanny synchronicity in their thoughts, mannerisms, and aspirations. They were inseparable, not just in their physical appearance, but in a profound psychological connection that would profoundly shape their destinies. Their parents, affluent and educated, nurtured their intellectual gifts, providing an environment rich in opportunities for learning and development. The Marcus household was one that valued academic excellence and professional achievement, instilling in the boys a strong drive to succeed in the most challenging of fields. Their intellectual prowess was evident from a young age. Both Cyril and Stewart displayed exceptional intelligence, effortlessly excelling in their studies. They were naturally curious, voracious readers, and possessed a keen analytical ability that set them apart from their peers. Their academic careers were stellar, culminating in their acceptance into the prestigious Syracuse University. This was a significant accomplishment, signaling their trajectory towards a life of academic and professional distinction. At Syracuse, they continued to shine, often studying together, their individual brilliance amplified by their collaborative approach. They navigated complex subjects with ease, consistently earning top grades and further solidifying their reputation as academic prodigies. However, it was their decision to pursue medicine that truly cemented their path towards a shared future. Both brothers enrolled in the State University of New York Upstate Medical University in Syracuse. The choice of medicine was not just a testament to their intelligence, but also to a perceived calling for a profession that demanded precision, intellect, and a high degree of control. They shared a fascination with the intricacies of the human body and a drive to master its complexities. Their time in medical school was marked by the same intense, collaborative focus that characterized their undergraduate years. They were known for their tireless work ethic, often spending late nights in libraries and laboratories, pushing each other to achieve even greater understanding. Their identical appearance sometimes caused confusion among professors and fellow students, but their distinct personalities, while subtle, were initially apparent beneath the surface of their shared academic drive. Upon graduating from medical school, the Marcus brothers specialized in obstetrics and gynecology, a field that offered a unique blend of scientific challenge and direct patient care. Their decision to pursue the same highly specialized field further underscored their profound interconnectedness and their shared professional ambitions. They completed their residencies together, working side by side, developing an almost identical approach to patient diagnosis and treatment. Their synchronized movements in the operating room, their near telepathic understanding of each other's needs during complex procedures, became legendary among their colleagues. They were seen as a single, highly efficient unit, embodying a rare synergy in the medical profession. By the mid-1960s, Cyril and Stewart Marcus had established a highly successful joint practice in New York City, first on Park Avenue and later in a prestigious medical building on East 69th Street. Their reputation quickly grew within the city's affluent circles. They were highly sought-after gynecologists, particularly among the wealthy and elite. Patients trusted them implicitly, drawn by their combined expertise, their meticulous approach, and the unique comfort that some found in the presence of two identical, seemingly infallible doctors. Their waiting room was always full, their appointment books consistently booked months in advance. Financially, they thrived, accumulating significant wealth through their thriving practice. They acquired luxurious apartments, fine art, and other trappings of success, living a life of material comfort commensurate with their professional achievements. Beyond their private practice, the Marcus brothers also held prestigious positions at some of New York's most reputable hospitals. They were attending physicians at New York Hospital and lecturers at the Cornell University Medical College. These appointments were not merely honorary, they reflected the high regard in which their peers held their medical knowledge and surgical skills. They published papers in medical journals, attended conferences, and were seen as promising figures within their specialized field. Colleagues respected their intellectual rigor and their dedication to their profession. They were viewed as exemplary practitioners, intelligent, diligent, and entirely committed to their patients. However, beneath this veneer of immense success and professional distinction, subtle indicators of their unique and increasingly intense bond began to emerge. Their extreme closeness, once seen as an endearing quirk, started to manifest as an almost pathological dependence. They rarely socialized separately, attended all events together, and shared every aspect of their lives. While this seemed harmless initially, it hinted at a growing insularity, a world where the only people who truly mattered, and indeed truly existed, were the two of them. They had built a fortress of shared identity, and as their success grew, this fortress became more impenetrable, slowly isolating them from external relationships and influences that might have provided perspective and balance. Their patients, their colleagues, even their families, were merely orbiting bodies in the universe they had created for two. This burgeoning isolation, disguised by their outward professional brilliance, was the first ominous sign of the psychological decline that would ultimately consume them. The promising trajectory of Cyril and Stewart Marcus, twin stars in New York City's prestigious medical firmament, began to subtly, then overtly deviate from the norm as their shared professional lives became increasingly intertwined with a nascent, yet pervasive, obsession with control. This wasn't merely the professional precision expected of top gynecologists. It was a deeply rooted psychological need that manifested in every aspect of their existence, gradually isolating them from the outside world and setting the stage for their eventual decline. Their meticulousness in their medical practice, once a hallmark of their excellence, morphed into an almost pathological rigidity. They were renowned for their precise surgical techniques and diagnostic accuracy, but this exactitude began to extend beyond the operating room into an inflexible routine governing their daily lives. Every aspect of their schedule, from the timing of their meals to the sequence of their patient appointments, became an unyielding ritual. Deviations from this self-imposed order were met with visible distress and irritation, suggesting an underlying anxiety that could only be quelled by absolute predictability. This quest for perfect order was, in effect, an attempt to exert total control over their immediate environment. This obsession with control manifested most strikingly in their personal lives, which became increasingly hermetic. The Marcus brothers, who had always been exceptionally close, began to actively withdraw from social interactions that did not directly involve both of them. They rarely entertained guests in their luxurious apartments, and invitations to social events were almost always declined if one brother was unavailable or unwilling to attend. Their social circle dwindled, eventually comprising only a handful of distant relatives and professional acquaintances, all of whom reported a growing difficulty in engaging with the twins individually. They presented as a singular unit, an impenetrable duo, making it virtually impossible for anyone to establish an independent relationship with either Cyril or Stewart. This self-imposed isolation, disguised initially as shared devotion, became a psychological barrier to external influence or differing perspectives. The most critical symptom of this burgeoning obsession was their increasing isolation from their own families, beyond each other. While they maintained a superficial relationship with their parents, and later, more distant relatives, the depth of familial connection withered. Siblings, cousins, and old friends found themselves increasingly shut out. This wasn't a sudden, dramatic break, but a gradual, almost imperceptible drifting apart, as the twins became more and more self-sufficient in their shared world. Their only significant emotional connection remained with each other, creating an echo chamber where their thoughts and perceptions were constantly reinforced without challenge or external validation. This intense, insular bond meant they relied solely on each other for emotional support, intellectual stimulation, and validation, inadvertently amplifying any shared anxieties or idiosyncratic beliefs. Within their shared medical practice, their quest for control translated into an almost paranoid aversion to delegating tasks. They personally oversaw every detail, from ordering supplies to managing patient records, even as their practice grew exponentially. They were reluctant to hire additional staff beyond what was absolutely necessary, and those they did employ were subjected to intense scrutiny and rigid adherence to the twins' exacting standards. This inability to trust others with responsibility stemmed from a deep-seated need to maintain direct oversight over every single aspect of their professional lives, fearing that any deviation from their methods would lead to chaos or perceived imperfection. This over-involvement eventually became a significant burden as their practice expanded, stretching their time and energy to breaking point. Their medical decision-making, once based purely on scientific evidence, gradually became colored by this need for control. While they remained highly skilled surgeons and diagnosticians, they developed specific, often unconventional methods and protocols that they rigorously enforced. They were reluctant to embrace new medical advancements or alternative treatments that deviated from their established routines, preferring to rely on their own tried and true, albeit increasingly outdated, approaches. This resistance to external ideas, even within their professional sphere, was a subtle but significant sign of their growing insularity and their belief that their methods were inherently superior, impervious to outside critique. This resistance to external ideas would eventually impact their professional standing as the medical field around them evolved. The psychological ramifications of this escalating need for control were profound. Their shared obsession created a feedback loop, reinforcing each other's anxieties and peculiar habits. Any external challenge to their meticulously constructed world, no matter how minor, was perceived as a threat. A delayed appointment, a misplaced file, or a conflicting opinion from a colleague could trigger disproportionate reactions of agitation and frustration. This hypersensitivity to disruption further fueled their desire for control, trapping them in a reinforcing cycle. They sought refuge in the predictability of their routines, which provided a fragile sense of security against a world they perceived as increasingly chaotic and uncontrollable. This shared pathology meant that neither brother served as a corrective influence on the other. Instead, they acted as mirrors, reflecting and amplifying each other's growing eccentricities. Where one might have provided a grounding force for the other in a typical sibling relationship, Cyril and Stewart instead egged each other on, their shared delusions strengthening their collective grip on an increasingly distorted reality. This lack of external checks and balances allowed their internal world to become increasingly self-contained and idiosyncratic, making it almost impossible for anyone outside their unique dynamic to intervene or even fully comprehend the extent of their psychological divergence. The early signs of this escalating control obsession were subtle, almost imperceptible, against the backdrop of their immense professional success. To outsiders, their shared apartments and synchronized lives simply reflected an admirable fraternal bond and dedication to their demanding careers. But to those who observed them closely or attempted to penetrate their tightly knit world, a chilling pattern emerged. A gradual retreat from society, a rigid adherence to self-imposed rules, and an almost desperate need to micromanage every aspect of their existence. This obsessive need for control, initially a source of their perceived professional excellence, would eventually become the very mechanism that propelled them into a shared psychological decline, tearing apart the fabric of their brilliant careers and ultimately consuming their lives. The control they so desperately sought ultimately became the control that their declining minds exerted over them, leading them down a path from meticulousness to madness. The meticulous control that had once defined the Marcus brothers' lives and professional practices gradually tightened its grip, transforming from a hallmark of excellence into the insidious roots of a profound psychological decline. This descent was not abrupt, but a slow, almost imperceptible unraveling, amplified by their pathological reliance on each other and their increasing isolation from external reality. Their shared world, once a source of strength, became a pressure cooker, mirroring and magnifying their individual anxieties until their collective sanity began to fracture. One of the earliest and most significant indicators of their deepening psychological decline was their deteriorating professional conduct. The impeccable standards that had earned them their prestigious reputation began to erode. While they continued to operate their successful Park Avenue and later East 69th Street practice, subtle changes became apparent to their staff and eventually to their patients. Their appointments, once rigidly punctual, grew increasingly erratic. They would sometimes forget scheduled procedures or mix up patient files. Their famed surgical precision, while not entirely vanishing, showed moments of hesitation or uncharacteristic errors. This was particularly alarming for a profession that demanded absolute focus and accuracy. Their paranoia began to escalate, first subtly, then overtly. They developed a deep distrust of almost everyone outside their immediate insular circle. Colleagues at New York Hospital and Cornell University Medical College, once respected, became suspected rivals or conspirators. They believed other doctors were trying to steal their patients or undermine their practice. This paranoia extended to their staff, whom they began to accuse of various infractions, often without basis. They started keeping meticulous, almost obsessive records of minor perceived slights or supposed betrayals, transforming their offices into an atmosphere of suspicion and fear. This meant that any potential interventions from concerned colleagues were quickly shut down, as the twins interpreted such gestures as further proof of malevolent intent. The brothers' personal hygiene and appearance, once immaculate, began to visibly suffer. They started neglecting their grooming, appearing disheveled and unkempt. Their luxurious apartments, once showcases of their wealth and success, slowly descended into squalor. Stacks of unread newspapers, medical journals, and unfiled patient records began to pile up, creating a chaotic environment that belied their earlier obsession with order. The cleanliness they demanded in their medical practice vanished in their personal spaces, reflecting a deeper internal disorganization. This deterioration was particularly striking given their former fastidiousness and the high society circles they once moved in. Their social withdrawal intensified dramatically. What began as a mere preference for each other's company escalated into near-total reclusiveness. They actively severed ties with any remaining friends or distant relatives, refusing calls and avoiding all social engagements. Their world shrank until it encompassed little more than their office and their apartments, with each other as their sole companions. This profound isolation meant there were no external voices to challenge their increasingly distorted perceptions, no grounding influences to pull them back from the precipice of shared delusion. They fed off each other's fears and anxieties, amplifying them in a hermetically sealed echo chamber. As their mental state deteriorated, their drug use began to escalate, becoming a significant factor in their decline. While the specifics are not fully detailed in general accounts, it's understood that they became dependent on certain medications, possibly barbiturates or other sedatives, to manage their anxiety and maintain their increasingly fragile grip on reality. This self-medication would have further impaired their cognitive function, exacerbating their paranoia, disorganization, and detachment from reality. The drugs provided temporary escape, but ultimately accelerated their spiral into full-blown psychosis. Their shared delusions became more pronounced and bizarre. While the precise nature of these delusions is largely private, it's understood they began to believe in various conspiracies against them. They might have imagined that certain individuals or groups were actively working to sabotage their careers, or even threaten their lives. These shared paranoid ideations, reinforced by each other, solidified their conviction that the outside world was a hostile and dangerous place, further justifying their extreme isolation. This reciprocal reinforcement of delusions is a key characteristic of folie à deux, or shared psychotic disorder, where two closely associated individuals share the same delusion. The most tragic manifestation of their psychological decline was the deterioration of their relationship with their patients. Despite their increasing paranoia and eccentricity, they continued to see patients, often operating under the influence of their declining mental state. While many patients remained loyal, drawn by their past reputation, or perhaps unaware of the true extent of their decline, others began to notice unsettling changes. There were reports of erratic behavior during appointments, inappropriate comments, and a general lack of the meticulous care they once provided. The very foundation of their professional identity, their skill as doctors, was crumbling under the weight of their shared madness. The external world began to take notice as their behavior became increasingly problematic. Complaints from patients, concerns from hospital staff, and the general oddity of their reclusive lives began to attract attention. While the medical community was initially hesitant to intervene due to their past prominence, the growing evidence of their psychological instability and its impact on their practice became undeniable. There were likely attempts by concerned colleagues or hospital administrators to address their issues, but these efforts would have been met with fierce resistance, paranoia, and outright denial from the Marcus brothers, who saw any intervention as further proof of a conspiracy against them. Ultimately, their psychological decline led to their inability to function normally within their highly demanding profession. Their practice, though still financially lucrative, became unsustainable in terms of quality of care and professional ethics. The walls of their insular world, once self-constructed, began to close in on them, not as a refuge, but as a prison of their own making. The intellectual giants who had once commanded respect in the medical field were slowly consumed by their own internal demons, their shared obsession transforming into a shared madness that would lead them to a tragic and solitary end. The promising brothers had fallen, victims of a psychological decline that neither could arrest, caught in a shared spiral from which there was no escape. Their descent into madness was a stark reminder of the fragility of the human mind, even the most brilliant. The psychological decline of Cyril and Stewart Marcus, fueled by their escalating paranoia and mutual reinforcement, inexorably led them down a path of extreme isolation that ultimately culminated in their tragic and solitary deaths. As their minds deteriorated, the external world became an increasingly hostile and incomprehensible place, pushing them further into their self-created, insular universe. Their once thriving medical practice, the bedrock of their professional identity and financial success, began to crumble under the weight of their madness. Patients, accustomed to their meticulous care, grew increasingly concerned by their erratic behavior, unkempt appearance, and often paranoid outbursts. While some loyal clients remained, many sought care elsewhere, wary of the unpredictable and deteriorating twins. Hospital privileges at prestigious institutions like New York Hospital were likely suspended or revoked as their professional conduct became a liability. Colleagues, once respectful, found it impossible to work with them, and any attempts to intervene were met with fierce resistance and accusations of conspiracy. The twins, steeped in their delusions, likely believed these professional setbacks were further proof of the world conspiring against them, rather than a direct consequence of their own deteriorating mental health. Their financial empire, though built on years of success, would have started to strain under reduced patient numbers and the sheer disorganization of their lives. Their personal lives, already hermetically sealed, contracted even further. They became complete recluses, rarely leaving their East 69th Street townhouse, which rapidly devolved into a state of extreme squalor. The meticulous order that once defined their living spaces vanished, replaced by accumulating filth and disorder. Unopened mail, decaying food, medical waste, and piles of discarded items would have created an uninhabitable environment. This neglect of their living conditions reflected the profound disorganization within their minds. Basic self-care, like bathing and eating properly, likely became sporadic or neglected entirely, further exacerbating their physical and mental fragility. Their bodies, once robust and well-maintained, would have begun to show the signs of severe neglect, poor nutrition, and chronic stress. The twins' relationship with each other, their singular source of emotional and intellectual sustenance, became the final, most potent instrument of their self-destruction. Their shared delusions created a powerful feedback loop. Each brother's paranoia and irrational fears were constantly validated and amplified by the other. There was no outside perspective, no voice of reason to break through their shared psychotic state. They became two men trapped in a self-reinforcing echo chamber of madness, spiraling deeper into a reality comprehensible only to themselves. This folie à deux, or shared psychotic disorder, meant that neither could pull the other back from the brink. Instead, they dragged each other down. Their conversations would have become increasingly consumed by their paranoid fantasies, isolating them even further from any semblance of normal human interaction. As their isolation deepened, their physical health would have declined in tandem with their mental state. Neglect of personal hygiene, erratic eating habits, and likely continued self-medication with sedatives or other drugs would have weakened their immune systems and masked underlying health issues. They would have likely stopped seeing doctors themselves, distrusting the medical profession they once exemplified. Their bodies, once instruments of precise surgical skill, became conduits for their internal decay. The precise details of their final days are shrouded in the tragic privacy of their self-imposed isolation. What is known, however, is that they became increasingly frail and unwell. Neighbors and building staff, if they existed, would have noticed the signs: unkempt appearances, the pervasive smell emanating from their apartment, and the cessation of their once predictable routines. Concerned individuals might have attempted to check on them, but the twins, in their paranoid state, would have likely rebuffed any attempts at contact, convinced they were being spied upon or threatened. The end came in the summer of 1975. On July 11, 1975, Stewart Marcus was discovered dead in their townhouse. He had died from a heart attack, likely exacerbated by years of neglect, stress, and poor health habits. The discovery of his body by someone, perhaps a concerned relative who finally forced entry, or building staff alerted by an odor, would have been a shocking revelation of the squalor and despair in which the once distinguished doctors had been living. What followed Stewart's death reveals the terrifying depth of their shared psychosis and Cyril's profound dependence. When Stewart's body was removed, Cyril, already deeply disturbed, was utterly distraught and disoriented. The removal of his twin, his only tether to his increasingly distorted reality, severed the last remaining link to a shared world. He refused to acknowledge Stewart's death as permanent. In his delusional state, he believed that his brother was not truly gone, but was merely away or sleeping, or perhaps even taken by the very conspirators they had imagined. He insisted on keeping Stewart's possessions, perhaps even his ashes, as if maintaining a physical presence would bridge the void left by his twin's absence. Cyril, now entirely alone in his madness, deteriorated rapidly. Without Stewart, the echo chamber of their shared delusion collapsed, leaving Cyril adrift in a terrifying, singular reality. He became even more withdrawn, his physical health plummeting without the reciprocal care, or at least the shared routine that had existed, however warped, with his brother. The shock and grief of Stewart's death, coupled with his already compromised mental and physical state, proved to be too much. Just 2 days after Stewart's death, on July 13, 1975, Cyril Marcus died in the same townhouse. His cause of death was also a heart attack, the stress and trauma of his brother's passing undoubtedly a contributing factor, along with his own severe neglect. The nearly simultaneous deaths of the Marcus brothers, once inseparable in life and madness, brought a tragic and shocking end to their bizarre story. Their deaths, though private, revealed the full extent of their self-inflicted decline to the public. The scene discovered in their townhouse, the squalor, the evidence of their extreme reclusiveness, and the proximity of their deaths shocked New York City. The media, which had once heralded their professional successes, now reported on their tragic demise with a morbid fascination, highlighting the dramatic fall from grace of these once promising figures. The story became a cautionary tale, a stark illustration of how mental illness, particularly when amplified by intense isolation and shared delusion, could utterly consume even the most brilliant of minds. The Marcus brothers, who had once held lives in their hands, ultimately lost control of their own, succumbing to a slow, agonizing demise born of their profound psychological fragmentation and extreme isolation. Their shared lives had ended in shared death, a final, tragic testament to their inseparable bond. The public's reaction to the tragic deaths of Cyril and Stewart Marcus was one of profound shock, morbid fascination, and ultimately a catalyst for a broader debate on mental illness and the responsibilities of the medical community. The news of two highly respected, once brilliant gynecologists found dead in squalor within their lavish New York City townhouse sent ripples through both the elite circles they had once served and the general populace. Initially, the prevailing sentiment was one of bewilderment and disbelief. How could two men who had achieved such heights of professional success and intellect descend into such a state of reclusive madness and neglect? The stark contrast between their public image as meticulous and successful doctors and the horrifying reality of their private lives was a jarring revelation. Media reports, while often sensational, highlighted the squalor of their living conditions, the stacks of accumulated trash, and the evidence of their extreme isolation. This immediate reaction was largely one of shock and a morbid curiosity about the how and why of their dramatic fall from grace. People struggled to reconcile the image of the Marcus brothers they knew with the tragic figures found in that decaying townhouse. As more details emerged, the public reaction evolved from mere curiosity to a deeper, more unsettling reflection. The story forced uncomfortable questions about the nature of mental illness itself. For many, the Marcus twins embodied a terrifying paradox: highly intelligent, functionally brilliant individuals who, despite their intellectual capabilities, succumbed to a profound and debilitating psychological disorder. This challenged the then common, simplistic understanding of mental illness as solely affecting those with overt intellectual deficits or obvious outward signs of distress. The Marcus brothers' case demonstrated that even the most normal or successful individuals could be silently battling severe psychological conditions, eroding their lives from the inside out. The case fueled a nascent public debate on mental health awareness and stigma. In the 1970s, mental illness was still largely stigmatized, often whispered about in hushed tones, and those affected were frequently ostracized or institutionalized without adequate care. The Marcus tragedy, however, brought the discussion out into the open. albeit through a sensational lens. It forced people to consider that mental illness was not always visible, that it could affect anyone, regardless of their social standing or intellect. This tragic example served as a powerful, if grim, case study that contributed to a slow but growing recognition of mental health as a legitimate public health concern, rather than a moral failing or personal weakness. Within the medical community, the deaths of Cyril and Stewart Marcus sparked a particularly poignant and self-critical examination. Their colleagues and peers were forced to confront uncomfortable questions. How could two doctors, so prominent within their field, fall through the cracks? Were there warning signs that were missed or ignored? Was the competitive, insular nature of their profession, particularly in affluent, high-pressure environments like New York City, a contributing factor to their isolation and subsequent decline? The case undoubtedly highlighted the need for greater vigilance and intervention within professional circles. While confidentiality and professional courtesy are paramount, the Marcus twins' story underscored the ethical obligation of colleagues to address mental health issues in their peers, especially when those issues could impact patient care. It raised questions about professional oversight bodies and whether existing mechanisms were sufficient to identify and support practitioners struggling with mental illness before their conditions reached such a catastrophic point. The tragedy served as a stark reminder that doctors, despite their expertise, are not immune to illness, and that their professional environment, if not supportive, could exacerbate existing vulnerabilities. Furthermore, the Marcus case brought to light the complexities of folie à deux, or shared psychotic disorder. For mental health professionals, the twins' story became a compelling, albeit tragic, example of this rare phenomenon. The intense, insular bond between Cyril and Stewart created a self-reinforcing echo chamber where their individual paranoid delusions were validated and amplified by the other, leading to a shared, increasingly distorted reality. This aspect of their story provided invaluable, if grim, insights into the dynamics of shared psychosis and the unique challenges it presents for diagnosis and intervention. It demonstrated how deeply intertwined minds, particularly identical twins with an already profound connection, could descend into a synchronized madness, making external intervention incredibly difficult due to their mutual confirmation of false beliefs. The ethical implications of their continued practice, while in decline, also came under scrutiny. The fact that patients were still seeing them, even as their professionalism waned, raised questions about patient awareness, the difficulty of recognizing mental deterioration in highly intelligent individuals, and the broader responsibility of the healthcare system to protect patients from impaired practitioners. It highlighted the challenges in balancing patient autonomy with the need for professional oversight and intervention in cases of mental illness affecting medical competence. In the decades that followed, the story of the Marcus twins endured as a powerful, albeit chilling, narrative. It became a cautionary tale taught in medical ethics courses, discussed in psychology textbooks, and analyzed in documentaries and true crime accounts. Their lives served as a stark example of how brilliant minds could be undone by psychological illness, especially when compounded by social isolation and the absence of intervention. The sensational nature of their story ensured its longevity in the public imagination, maintaining its relevance long after the immediate shock subsided. While the Marcus brothers' tragedy did not single-handedly revolutionize mental health care, it undoubtedly contributed to the slow, evolving shift in public attitudes. It chipped away at the silence and shame surrounding mental illness, urging a more open dialogue and a greater understanding of its complexities. It underscored the importance of recognizing the early signs of mental health deterioration, fostering supportive communities, and implementing robust oversight mechanisms within professions where impaired judgment can have dire consequences. Their story remains a somber reminder of the profound impact of unchecked mental illness, serving as a powerful, enduring testament to the need for compassion, vigilance, and continued advocacy in the realm of psychological well-being. The tragic saga of Cyril and Stewart Marcus is a haunting reminder that even the most brilliant minds are not immune to the shadows of mental illness, and that isolation can deepen the darkest struggles. Their story forces us to reflect on our understanding of mental health and the responsibility we have, as a society and as individuals, to look out for one another. What are your thoughts on the Marcus twins' incredible fall from grace? Share your insights in the comments below and let's keep this vital conversation going. If you found this deep dive into their shared madness both captivating and thought-provoking, please hit that like button. Subscribe to The Dark Chapters for more true stories that peel back the layers of human psychology, and ring the notification bell so you never miss another profound journey into the complexities of the human condition. And don't forget to share this video with someone who needs to hear this powerful, cautionary tale.